Nursing care comes in many forms. Sometimes it is the ability to make someone feel physically comfortable by various means. Other times, it is the ability to improve one's body's ability to achieve or maintain health. But often it is uncanny yet well-known knack to see beyond the obvious and address in some way the deeper needs of the human soul. Donna Wilk Cardillo, A Daybook for Beginning Nurses. Nursing is the fastest growing occupation in the U.S. Nurses make up the majority of our healthcare industry, and that number is on the rise. With 581,500 more nursing jobs expected by 2018, according to Johnson & Johnson's website. I have gained knowledge about nursing through volunteering as a chaplain at our local hospital over the last 10 years, and for my wife as serving as an RN for the last 22 years. If you are looking for a career that gives you the opportunity to minister to people through serving their needs and the needs of their families, becoming a licensed nurse could be the career path for you. I will first present the education needed to becoming a registered nurse. Secondly, I will present the growing need for nurses within the U.S. And thirdly, I will present the opportunity to minister to patients and their families. I will now present the education and training needed to become a licensed nurse. According to the Kentucky Board of Nursing website, there are 3 nursing degree programs that lead to initial licensure: a licensed practical nurse, a registered nurse, and a Bachelor of Science in Nursing. The LPN requires the least amount of time, with 40 to 46 hours. An associate's degree RN program requires 65 to 70 credit hours, with approximately half of these in science and humanities and the other half in the nursing major. A baccalaureate degree, the applicant must meet entrance requirements of the university, college, and the nursing program. This is a 4-year program with at least 2 years in general education with a concentration in humanities, social, and physical sciences. The last 2 years cover both nursing theory and clinical practice. All 3 degree programs require hours of supervised clinical practices in hospitals, clinics, and long-term care facilities. There is also a Master of Science degrees in nursing and doctoral programs for post-licensure degrees. The MSN is a graduate degree in nursing offered by senior colleges and universities. This degree is used for a specialty job in nursing. Graduates are prepared to work in a variety of settings. The master's degree is usually required for entry into the doctoral program. The doctoral program provides entry into professional nursing practice and preparation for national licensure. Graduates are prepared to practice across diverse healthcare settings. I will now present the nation's shortage of nurses. As we see the need for licensed nurses within the U.S., according to the American Association Colleges of Nursing website, the U.S. is projected to experience a shortage of RNs as the number of baby boomers, those born between 1946 and 1964, and their need for health care grows. The AACN also states that the compounding need for nurses is also the fact that nursing schools across the country are struggling to expand capacity to meet the rising demand for care given to the national move toward healthcare reform. According to the Bureau of Labor Statistics employment projections released in February of 2012, the nursing workforce is the top job growth through 2020. It is expected to grow from 2.74 million in 2010 to more than 345 million by 2020. This is an increase of 26%. Of 26%. We will now look at how being a nurse will be an opportunity for you to serve Christ. Becoming a nurse gives you the opportunity to minister to patients and their families also. Historically, the nursing profession has roots in the Christian concept of ministry. Many of the caring qualities of today's nurses are pastoral in nature and contribute richly to healing. Examining nurses as a ministry provides an opportunity to consider the nature of nursing as it moves forward. There's also parish nursing. A parish nurse would be an employee of the church. A parish nurse would be a registered nurse who has additional training in holistic ministry, helping members of the congregation to become more aware of their health and move toward a fuller sense of the wholeness. What do parish nurses do? They visit church members at home. They provide counseling on health-related issues. They make referrals to community and health services. They assist members in adapting to important lifestyle changes. They teach classes on maintaining good health, develop support groups within the church, train and coordinate other volunteers, just to name a few. but they do not provide health care in the patient's home or inside the church. Jesus reminds us in Matthew 9:12, but when he heard it, he said, "Those who are well have no need of a physician, but those who are sick." So you will know it will take hard work on your part wanting to become a nurse. The time willing to be given to education will determine the degree program that you will follow. The number of jobs available in nursing would cause us to see the demand is high in the field of nursing. The opportunity to be able to minister to patients and families would be a great reason to look into the program as well. If you are looking for a job so that you can not only further your education, but that is in high demand, that would give you the opportunity to minister to patients and families, the field of nursing could very well be that opportunity.